This is Todd. Todd wakes up at 7 a.m. to go to the gym. It's his favorite part of the day. Todd then goes to class. He never skips classes and is an excellent student. Todd catches up with some friends after class before going home to eat dinner with his housemates. Todd loves to eat. But lately, Todd hasn't been feeling like himself. He has trouble sleeping at night. He doesn't feel motivated to work out in the gym in the morning like he used to. He's been having trouble concentrating in class and is losing his appetite. Todd's friends are worried about him and encourage him to go see a doctor. The doctor asks Todd to fill out a lifestyle questionnaire. The doctor analyzes Todd's symptoms and diagnoses him with major depressive disorder. Todd does not want to tell anybody about his depression, worried about what his friends might think if they found out. Don't worry, Todd. I will explain all there is to know about depression and clear up any misconceptions. To start off, what exactly is depression? Major depressive disorder is a mental health disorder characterized by persistently low mood. The average length of a depressive episode is seen to be 6 to 8 months. According to a study done by Rott and colleagues, nearly 20% of people will experience a major depressive episode at some point in their lives. Some of the major emotional symptoms include deep feelings of sadness, reduced interest in previously enjoyed activities, low sexual desire, restlessness, feelings of worthlessness, constant irritability, social withdrawal, and recurrent thoughts of suicide. There are also many physiological symptoms associated with depression. Some of the most prevalent include unintentional weight loss, insomnia, loss of energy, and even slowed movement or speech. Depression can really affect you in the long run. Behavior caused by depression can cause a downfall in a student's academic abilities, disrupt meaningful relationships with loved ones, and lead to malnutrition. Therefore, it is very important to seek treatment. Major depressive disorder can result from a number of things, especially for a student. It is likely due to a complex combination of factors including genetics. People who have first-degree relatives who also undergo depression are at a higher risk themselves. Personal life events. Tragic events such as the death of a family member, loss of a job, divorce, or any other type of stressful occurrence can increase chances of depression. Traumatic childhood. Sexual or psychological abuse, neglect, poverty, and an unhealthy lifestyle are a predisposition to developing depression later on in life. Drugs and medication. Prescribed medications such as corticosteroids can cause side effects resulting in depression. The abuse of recreational drugs, including amphetamines, can increase chances of depression too. There are different ways to treat depression, depending on the severity of the disorder and other circumstances. First off, there are several antidepressant medications that act upon different neurotransmitters in the body. Selective serotonin reuptake inhibitor, or SSRI, is an example of a drug that increases the amount of serotonin in the brain, which is a neurotransmitter associated with happiness. Although there are many drugs that can be obtained to eliminate depressive symptoms, it is not a long-term solution. Cognitive behavioral therapy, CBT, and interpersonal psychotherapy are the two main types of therapies used to treat depression. They help individuals focus on the present and encourage the regaining of control over mood and functioning. However, the best solution is to have support from loved ones to help alleviate feelings of depression. For example, having a sit-down talk with family members to discuss practical solutions to ongoing problems can reduce symptoms of depression. There are many facilities here at the McMaster campus to help students deal with depression. One of them includes the McMaster Wellness Center, where students are able to talk to counselors, receive advice, and join therapeutic groups with individuals experiencing similar problems. Additionally, the peer support line at McMaster allows any student to call and talk to volunteers about what they are feeling. Unfortunately, in this time and age, there is still stigmatization associated with depression. However, both education and spreading awareness are key to ending the stigma that occurs in society. This negative stereotype of disgrace or discredit towards individuals experiencing mental illness sets them apart from others. Not only does it hurt the feelings of individuals experiencing depression, but it also causes them to feel like they are not good enough. This must stop. The results of a study done by Stengler-Wensky and colleagues displays that 45% of people surveyed reported concrete instances of stigmatization after receiving treatment for depression. However, through treatment, education, and understanding, we can suppress the effects of major depressive disorder. Our goal is to put an end to stigmatization and to create a comfortable environment for everyone. By coming together and understanding depression is common and perfectly acceptable in our society. For more information, please visit wellness.mcmaster.ca.